Hello, class. My name is Jessica. I'm a PGY1 resident at Harper Hartsel University Hospital, and I'm going to be teaching you about osteoporosis prevention and treatment. Try not to be overwhelmed by the number of slides. I'm going to try my best to highlight the most important things that you need to know. Just keep in mind the objectives as you go through the learning material, kind of keeping in mind the big picture, but also trying to remember the specific things of drugs that may be tailored more for a certain population. Let's start with the basics. Osteoporosis means porous bone, which is characterized by low bone density, impaired bone architecture, and compromised bone strength. As a result, then there is bone fragility and an increased fracture risk. And if you look at the picture to your right, you can tell the differences between a normal bone and a bone with osteoporosis. And you could see why patients with osteoporosis would be at an increased risk of fracture because they do have more pores in the bone. This is a basic overview of bone remodeling. The bone is not stagnant, it's going to be constantly growing, and it goes through cycles that last about 3 to 4 months. This remodeling is going to be the highest when you're younger, so you're growing, and it's not like you have a bone and it stays the same. The two main workers of bone remodeling are osteoclasts and osteoblasts. Osteoclasts are in charge of bone resorption, or what I like to think of it is cut down bone. Osteoblasts are formation, so they build bone. When you're young, there is going to be more formation compared to resorption because you're growing. So when you get older, these two processes are going to even out. Unfortunately, though, it does come to a point where there's going to be more resorption than there is formation. But ultimately, what we want is osteoclasts, or cutting down bone that might be weak, or maybe there was still a little fracture, and it's going to cut that weakened bone, and the osteoblast should be kind of filling this in. But sometimes, like for example, young children that are still growing, you could see here that we have extra new bone because their osteoblasts have higher activity compared to the osteoclasts. And we do have 2 new feedback systems where we have new drugs for that, but I will go through that more towards the middle of the lecture. The reason why it is important is because osteoporosis should be prevented. 43.4 million people already have low bone mass, and if that's not getting taken care of, they're going to have osteoporosis. That number is 10.2 million people that have osteoporosis, and these are going to be the people that are at increased risks of getting a fracture. Women tend to have more osteoporosis compared to men, and you could see that in the percentage of fractures. So women have 70% fractures versus men, where it's only 30%, but we still want to treat these men. They also differ between different races and ethnicity because of the genetics. The highest is going to be in non-Hispanic whites, Fortunately, though, the rate does seem to be decreasing because they're being adequately treated. And there's actually conflicting data right now in Asians and Hispanics. Hip fracture specifically has a high risk of mortality. Within 1 year, about 25% of patients will die. And these two graphs here kind of show the differences between the different races slash ethnicities. So on the top here we have white, and on the bottom we have black. And in the middle we have Asians and Hispanics. So you could see that the osteoporosis or fractures are going to be more common in whites than it is in blacks. And Asians and Hispanics are here in the middle. What we want, though, is that this rate of fracture, we want everyone to be decreasing rather than increasing, because that means we're adequately treating. Now, if we look on the right, it's the same thing, same pattern, where we have whites are going to be at an increased risk of fracture compared to blacks. But again, we just want all of these people to be decreasing in rate because it's a preventable disease. So osteoporosis itself isn't the bad guy. It's the fractures that result from low bone density. I already mentioned the risk of mortality, and just in general, there's up to a 20% chance of mortality within 1 year, and this is greater in men. Other complications that can occur that lead to an increased cost to the health system. So we have pain, decreased mobility, rehab, residential living. And this does add up in costs for the U.S. health system. So it's estimated that it's going to be $25.3 billion if we don't take control of it. But another thing to consider is that these complications are also a burden to the patient and decrease the quality of life to the patient. And this is something that where pharmacists can jump in and treat osteoporosis the same way we would treat hypertension. It's something that should be getting equal attention. Now that we know the target population and the complications that result from osteoporosis, we need to collect more information and assess if prevention or treatment is indicated in these patients. So first, what we want to look at is the history. We want to see if there's any risk factors or family history. Then we can look at some signs. Specifically, a good indicator is a loss in height. Sometimes what happens is there could be fractures in the spine, and a patient might not even notice, might not even feel any pain, but we can tell by a decrease in height. So it is often asymptomatic, but some other symptoms that can occur are pain, depression, and low self-esteem. And finally, we do have labs and tests that can help. There are some markers that we can look at, and that would be calcium, vitamin D. These are just a few, but there are more. And we also have tools that are going to help us with assessing the risk of fracture. So that would be the FRAX tool. And we also have these tools that can help us have more detail on the density of the bone, or we can visually assess what's going on with the bone. The FRAX tool should be something that you are familiar with in one of your activities that you should have done with the interprofessional team, but I included it here just as a reminder.